All right, so the next thing that we'll do, while everything is still nice and wet, is we're going to choose our shade. Now with Will, he's bleached his teeth. In fact, we bleached his teeth 11 years ago. We did a 30-minute in-office high concentration bleaching agent. We didn't use lights or anything like that. We used the opalescence boost. But what we found is that generally the younger the patient, the faster they bleach. So because Will is bleached out so beautifully, I'm going to look for high-value shades. I'm going to automatically go into the high-value shade tabs. And the shade tabs that we're using here, this is part of the Vit-l-escence system. You can see Stan calls them shade sticks. I still tend to go for the old terminology and call them shade tabs. But what I'll do is I'll take 2 of the tabs, and sometimes 3, depending on if we've got a warmer situation, and I'll stack them on top of each other, and I take them to the tooth. Now, let me just reverse that right there. What we see here is a very high value shade called opaque snow. That's the one that's underneath. That's this one here. And then I'm going to take a beautiful white enamel shade. It has no warmth in it whatsoever. It's called Pearl Frost. I'm going to put those 2 together. So what we get is a nice high value, but we also get optical dimension. All right, so I'm going to try in my putty stent. And this is a PVS impression material. It's the putty, where you take a scoop of A and a scoop of B and you mix it together. And then you take basically an impression without an impression tray on a model that you've done the mock-up on. So I know what I want his smile to look like based on the mock-up that I've done. All right, so once we try the stent in to make sure it fits, that we've not had any distortion, and notice how he is biting down onto that stent. Close down for me, Will. That serves as my mouth prop and also my tongue retractor at this point, so he can swallow comfortably without me having to worry about saliva coming into the area where I'm working, and it also keeps him comfortable because now he's got something to prop him open. So I'm going to take this back out for a moment. On dried teeth, I'm going to take my Teflon tape,
which is tip number 2 if you're writing these little pearls down. You don't have to fight the memory of celluloid strips. Teflon tape, you can stretch it very tightly. You'll get a great contact. You don't have to do any wedging. And you don't risk bonding teeth together. It's just a wonderful product.
All right, so now I am still an etch and rinse person. I love my etch. It's served me well over many, many years, and I'm just not ready to give it up. If I've got a situation where I've got some bleeding involved, I will immediately switch over. I'll get the bleeding stopped, and then I will switch over to a self-etching bonding agent. My bonding agent, when I go to a self-etcher, is Peak, just because I put a lot of time and effort in ensuring that we're going to get good enamel bonds as well as good dentin bonds. So I'm going to fight, if I decide to switch over, I'm going to go with something that's going to give me enamel as well as dentin bonding. This is Ultra Etch. It's got a self-limiting etch to it. Do a little rinse here. A little dry. There we go. Now we'll place our bonding agent. And this is going to be the Peak LC Bond. This is radiopaque, just like PQ1 was.
Still has the ethanol carrier, which is nice because you can dry it easily.
All right, so make sure that my bonding agent is all over that tooth, including the incisal edge. Okay. Little air. Want to evaporate that ethanol. Usually just a short little air drying will do the job. Like I said, these aren't as powerful, but isn't it nice that they could put this up here for us? I'm not complaining. I think they've done a phenomenal job.
We're starting with opaque snow and opaque enamel. What we have here is a really nice enamel shade that slows the light down but doesn't completely block it. And so what that does is it allows us to not have peaks and valleys in light reflection and refraction. Jamie is a sculptor, and so when Jamie gets done, she has very little trimming to do. I make it look like a big old granite block, and then I play Michelangelo and try to chip out what the tooth is going to look like.
Yes, Stan's motto is never underestimate the power of a high-speed handpiece.
That's right.